Hey guys, it's Heather. Sorry it's been so long. This has been the craziest semester ever so far, but I just wanted to give you guys a quick update about how level 3 is going. I can't believe that I can say level 3. It's unbelievable. Anyway, so we have been in school for almost over a month now, which is insane, and it has been crazy busy. We have already had my pharmacology test, our comprehensive checkoff, our IV checkoff, and a regular test, plus 2 weeks of clinicals. So it has been a whirlwind of a semester, but it's been going really well. Pharmacology test was great. It was not a big deal. Made 100, which I'm glad about. The dosage calculation questions I actually thought were easier than they were last semester, and the medication questions were not hard, but they were a little bit more difficult than they were last semester. So I got that done out of the way, which was great. Our comprehensive checkoff was, wow, it was a crazy day. It was pretty, I don't know what happened that day. Everybody was kind of off their game a little bit. Tensions were very high that day, and I'm just glad that it's over. For my checkoff, I had to prepare insulin to give to my patient and also do a focused assessment for my patient based on their disease process, which they had congestive heart failure, they had diabetes, and then they also had pneumonia. So it was very intense and long. We were only supposed to have 30 minutes for a checkoff. I ended up taking an hour, as did many of the people in my class. So they had to kind of cancel that out as a factor of whether you pass or fail or not, because so many people went over the time limit. I don't know what it was that made us all so nervous and take so much time, but we all did. So hopefully next semester, when I have my last comprehensive checkoff, I won't have to worry about time limits again, because I'll kind of know more what to expect. But I passed, and I feel like I did a really good job. I just got really nervous on a couple things. I couldn't get the air bubbles out of my syringe, which was just annoying me, and I forgot the little trick of pulling the syringe all the way back and then up to get rid of all the bubbles, because you know our vials get used so many times in our lab that they just get all this air in them and stuff. And then I had an issue with not being able to hear the heart sounds on my mannequin, which was really stressful to me, because obviously I needed to be able to hear heart sounds and I just could not hear them. So yeah, and I also got checked off by our department chair, so the head of our department. So that was really nerve-wracking as well, but I passed, and so I'm really glad that's over with. We also had our checkoff for IVs, which was crazy too. We didn't have a checkoff on starting IVs. We practiced it, but they felt like we needed a more real-world experience rather than practicing on a mannequin who has, you know, the really tough skin and obviously prominent veins and stuff. But we did have to be checked off on some sort of skill, either IV push medications, adding medication to a piggyback, or something like that. And so I did that check off, and I did really well. I had to add IV piggyback to the main bag, to the primary bag, you know, flushing the tubing, hooking it up to the saline lock and all that stuff. So yeah, it was a really kind of intense day too. That checkoff is not as big of a deal as the other ones, because a lot of LVN programs, they don't teach you IVs. Actually, I've heard a lot of RN programs don't either, but anyways, a lot of LVN programs don't teach you IVs, so it's just an extra part of our curriculum that you know, we get to learn and stuff. And yeah, we get to have a little certificate at the end of our sorry, like my downstairs neighbor was like knocking really loud, and I don't know if it's something I'm doing or what, because I'm just sitting here, but it's throwing me off. Anyways, I'm sure they're hammering or something, but yeah, so we get a little certificate when we graduate that says that we're certified in IVs. So if you didn't pass the checkoff, it's not a big deal. You just have to keep practicing, and you get checked off another time or other times throughout the semester with your instructor to see if you passed or not. Because if you don't, you're not going to fail the program, but you just don't get the certificate at the end, and you don't quite meet your clinical objectives that they set for you. But yeah, so we also had our first test, and it was mainly over psych things, introduction to psych, ethical things about psych, patients and the rotation and all that stuff, and then also about anxiety and personality disorders. The test was crazy hard. It was one of the hardest ones we've had. Unfortunately, a lot of people in my class did not do so well. I did study a lot for this test because I was not sure what to expect. We had new teachers, and that's always nerve-wracking, as you know. You're not sure how their test questions are, but I'm so happy to say that only 5 people in my class made an A, and I was one of them, so I'm so happy that that happened. I was really not sure what to expect when I was taking my test. I was a nervous wreck. I was taking a long time to take it, and I usually don't take a super long time, but yeah, we're having our review on Tuesday, so it'll be an interesting review to see what questions are given back, because I know a lot of people were upset, but I'm glad I have a strong grade to start off my semester, just in case the other tests are just as hard and I'm not as lucky next time. But yeah, so also for clinicals, we have had our psych rotation, and my psych rotation is now done. Since it's a summer session, obviously we don't have a ton of time, so we have 2 weeks of the psych rotation, and then the rest of it's a med-surg rotation. And it got split up because we have such a large class into kind of sections where some people have their med-surg rotation first, then they'll have their psych rotation, they'll go to med-surg again, or something kind of the combination. Mine is that I had psych rotation first, and then the whole rest of my semester is my med-surg rotation. So we got to do that first, and it was just so interesting. Everybody was so nervous. They weren't sure what to expect because it was going to be completely different than anything anybody had ever done before. And everybody kind of had this stigma in their mind of what they thought a psychiatric hospital was like, but it was completely different than what I was expecting. It went so well. It was very laid back. We couldn't give meds or anything because they were there for such a short period of time, and the meds are very, they're very serious medications, I guess you could say. But I was really lucky. I got to be on adult floor and an adolescent pediatric floor, which was great. It was so nice to even be around kids for once, let alone to see them in a psychiatric setting. And I learned so much in the rotation, and I don't know if I want to be a psych nurse necessarily, but it was a very cool rotation. We got to sit down and interview them, and obviously look through the chart and just find out, about these people and their, diagnoses, and if they had a personality disorder to go along with it. There's, the 5 axes. If you haven't had psych rotation yet, you will, and you'll learn about the axes, but and you learn about, each one. Axis 1 is their medical diagnosis. Axis 2 is a secondary diagnosis, such as a personality disorder or mental retardation. Axis 3 is their medical diagnosis if they have hypertension or diabetes or something like that. Then there's another axis, Axis 4, which is their general functioning scale, which says on a 0 to 100 scale of how well they can function in day-to-day life based on their diagnoses. And then there's also what their what their hazards are, such as jobs, social life, support, stuff like that, for the axes. But anyways, you learn all about that kind of stuff and just how it all fits in with the medical world and the psychiatric world. And I just really enjoyed the experience. I'm really sad to see it go. It was, like I said, it was very laid back. I had 2 evening clinicals and a day clinical. We've been going 3 days a week for the summer, so that was a nice experience to see kind of how more the night shift goes. After this, every day in med-surg is a 6 a.m. clinical, so I'm gonna miss sleeping in a little bit, but yeah, it's been going really great. I've been learning so much. We learned about schizophrenia, which is completely different than what I thought it was, how it's actually, it's genetic, your brain is just completely different. It's not a normal person's brain. It's not just, hearing voices like everybody thinks it is. So I've really been enjoying learning more about these mental disorders that people have, and it's really given me a new understanding and respect for people that suffer from them. But yeah, I'm really enjoying the semester, guys. It does suck that it's summer, but it is really, honestly, almost halfway over already. I can't believe it. And then I start level 4, which, that's crazy. But yeah, that's about all I have to say. I'm sure I've been rambling too much, but if y'all guys have any questions for me, let me know. I'm going to do another video soon showing the psych book and stuff like that. And I really like the way it's set up. It's very interesting and how it's done and stuff like that. But if y'all guys have any questions, let me know. I hope y'all guys are having a good summer semester if y'all are going in the summer. And if you aren't, I'm jealous, and enjoy y'all's summer. I'll talk to y'all soon.